Today we're going to talk about something that is gaining traction and is looking more and more like a viable way of improving your health, at least here in modern times. It's been around for centuries, maybe even millennia. And that's the use of water, hot water or hot steam, whether you call it hydrotherapy or sauna. And what is the science behind how this type of therapy can help you not only in the acute setting, but if done on a regular basis, could also help your longevity. So this is something that they're looking into with great detail. So we have known as human beings for a long time that there are health benefits associated with bathing in baths. So this goes back for millennia. The Romans used to do it. In fact, there's a city in Great Britain called Bath, and it's because of the baths that were there. It actually was an ancient Roman city. That's not where this is, but you can see here that these people here are also bathing. So what's the science behind it? There's a lot of different ways today that you can use water, steam, heat to help your longevity. We can use showers, you can use tubs, you can use saunas, as we see here in the upper right-hand corner, and also apply hot packs to the body. Is this, all kind of like loosey-goosey science, or is there actually something behind it? And what you'll see here as we'll talk about this as hydrotherapy, but it can also be used in terms of something called contrast showers, baths, saunas, or even fomentations. And generally speaking, what you'll see used over and over again, and this goes back in terms of tradition for many, many years, now the science is bearing this through, is that there is a long period of heat where the subject or the patient is exposed to heat and they sweat. And then right at the end of it, they're exposed to a short period of cold. And that is something that we see with contrast showers. That is something that we see with baths. That is something that we see in sauna use. This is in Finland, where saunas are used extensively for a long period of time in this regard. But okay, not just Finland, in many, many countries of the world, especially in Europe. But we look at Finland because so many people in Finland do sauna, so it's an interesting country to research. They do the same thing. They go into the sauna for a long period of time, and then they come outside and actually hit themselves with little branches of a tree, or they might roll around in the snow. And then sometimes they'll even repeat this again. So this is not uncommon to repeat this cycle. But it's always the same cycle of heat at the beginning and a short amount of cold at the end. So let's talk about saunas first, because I think a lot of people are familiar with that. A sauna, basically they have different types. There's infrared saunas, which we won't talk about here, and are ways of trying to duplicate what we see in saunas. So there's various ways of heating up saunas that are infrared versus simple heat. Sometimes they're moist, sometimes they're dry, and sometimes that makes it difficult to do studies because there's different varying ways. I think the temperature that you want to think about if you're talking about a regular sauna is to getting up to 174 degrees Fahrenheit and sustaining for at least 20 minutes, followed by a cool down. You can repeat that about 2 to 3 times. That's generally how saunas are used. We'll talk about what the science is behind this. In Finland, it's very common. About 99% of the people in Finland actually do saunas, and or do sauna, as they would call it. Most do it at least once a week. Others of them will do it at every day, so that's 7 times per week. So what happens, of course, is when you go into a hot room, or when you apply hot packs, this can be applied to showers or even fomentations, is the skin temperature raises first, and then finally the core body temperature. And you can actually get core body temperatures up to 102 degrees Fahrenheit or 39 degrees Celsius in doing just this. And what that will do is it will increase the cardiac output, so the amount of energy that the heart is using and the heart is expending. So it's almost like exercise. And there will be actually an increase in the volume of your plasma. That's the blood volume. And also there'll be an increase in sweating. We'll talk more about sweating in terms of getting rid of toxins and things that can be gotten rid of in sweat that not necessarily can be gotten rid of as easily in your urine or in your stool. One of the things that's very interesting about heating up the core body temperature is this thing in terms of heat shock proteins. So heat shock proteins are enzymes that the body has that the body uses to help fold proteins in the appropriate manner. And when things get hot, those proteins in your body that are working normally can become unfolded. And that's a problem with too much heat. That's why your body wants to regulate your body temperature. Well, these heat shock proteins go out and they refold the proteins back. And so it's important to have heat shock proteins if you're going to be exposed to heat. And so what we notice is this: people who are exposed to heat over and over and over again will have an improvement or an increase in the function of their heat shock proteins, which makes them more able to deal with heat. But that's not all that heat shock proteins are involved with. They're also involved with immune function, which of course is very important, cell signaling, and regulation of protein folding like we talked about before. Saunas also increase interferon. We'll talk more about that in a little bit. So cytokine release, this is all a part of your immune system and immune functions. And something called mitochondrial biogenesis. This is a nice way of just saying basically mitochondria, which are the powerhouses of your cells. These are like the engines that run your cells. They can duplicate themselves more when you are in saunas, or there's repeated heating and cooling sessions that you have on a weekly basis. Getting more technical, there's some other things that can increase, like NRF2. This regulates the heat shock proteins, and it also is involved with regulation of inflammation, both of pro-inflammatory and anti-inflammatory proteins, and it's involved in cardiovascular disease. So you can see here that just heating your body up and cooling it down has more effects than just temperature. It actually affects your immune system. It affects your inflammatory system. It affects your cardiovascular system. And folks, here's the point. Increases in FOXO3 proteins and sirtuins. Now, if you don't know what those are, these are proteins that are been recently on the stage and really hot topics for those that are dealing with and looking at longevity. Why do people live longer? Well, the proteins that they're seeing that are involved in living longer are also improved and increased when you go into saunas and when you take hot showers and things of that nature, when you increase the body temperature and then cool down. So it's going to be important to learn about this, because I think this has a real importance in terms of those who are interested in living longer and healthier. IL-6, which is an interleukin, this is involved in inflammatory things, comes from exercise. It increases inflammation. It also stimulates IL-10, which reduces inflammation. So inflammation is not all bad, right? So if you've got an infection, you want inflammation to attract attention from your immune system to deal with that invader. But then you don't want inflammation from the rest of your life, right? You want to actually be able to cool that down. And so there are cell signaling pathways that reduce that and get rid of inflammation after you're done dealing with the issue. So it's complex. It's not something that you can just say black and white, this is good, this is bad. But what regulates all of this is your immune system, your body. And if we can improve your body by improving heat and cold, then that is something that's worthwhile looking into. So this is kind of a little bit of a foray into what we're talking about today and how this might work. Okay, so let's talk a little bit about cardiovascular health. And these research studies are coming out of Finland at just breakneck speed. And the reason is because everybody in Finland does sauna, and so it's really easy to study. But people do it in different amounts. Some people do it 7 times a week, like we talked about. Most people just do it maybe 0 to 1 times per week. And as we said, 99% of the people in Finland do sauna. In fact, it's kind of interesting. If everybody in Finland wanted to, at the same time, go into a sauna, there would actually be enough room in the saunas in the country of Finland to accommodate everybody. That's how popular it is. People do this literally on a nightly basis. So here's a study that was published in Complementary Therapies in Medicine just a couple of years ago, where they took 19 healthy volunteers, 12 male, 7 female. Mean age was about 46 years of age. And they did 25 minutes in a sauna session with an exercise load of about 60 to 100 watts, which is a moderate amount of exercise. And so what did they find? They found that when they did this, they actually found that blood pressure drops when you get into the sauna. So that's important to understand. or at least that's what they thought they would find. What they actually found was that contrary to previous reports that blood pressure drops during a sauna stay, what they found was that actually blood pressure went up during a sauna session. And not only blood pressure, but also heart rate. Meaning what they're saying here is that sauna use is almost equivalent to exercise. This is really important because I can't tell you how many people I've seen in my clinic that say, Doc, I'd love to exercise, but my knee or my foot or my this or my that or my other. And I'm saying to you is that, well, if your heart is able to tolerate this kind of exercise, it may be beneficial for you to think about investing in a sauna or getting hot-cold therapy on a regular basis in some other way, either through a spa, or you could even, as we'll talk about later, warm up towels and in a microwave and apply it to you in a safe way. We'll talk a little bit more about that. But what we're saying here is that if you can't get the exercise that you need, or even if you can get the exercise that you need, a way of enhancing that exercise may be sauna use, because what we're seeing here is physiologically some things that are identical. Acute heat exposure they found in the sauna is a burden comparable to moderate physical exercise. And the sustained decrease in blood pressure after heat exposure suggests that the sauna bath will have a beneficial effect on the cardiovascular system. So in other words, you're in the sauna, blood pressure goes up, you're done, there's a sustained reduction in blood pressure afterwards. And this may actually be very beneficial in terms of circulation, getting the blood to circulate around in your body, to clean out the toxins, to give nutrients to your cells, and also to improve your cardiovascular health. So interesting study published just recently. But wait, there's more information, because some people might say, well, those that are using the sauna may be noticing better health benefits because people in general who are more health conscious may be using the sauna. But actually, as it turns out, when you look at this association between the amount of sauna, so the people that use it only 1 time per week versus those that use it 2 to 3 times per week, versus those that use it 4 to 7 times per week. And you can see here that there's a significant reduction in relative risk for fatal cardiovascular and all-cause mortality events. I mean, this is huge, folks. Okay, this is all-cause mortality events. Notice that the more you use sauna, there's a dose-respondent curve, that there is a reduction in relative risk for all-cause mortality. And you can see here, this is not a small study. This is 2,300 patients looking at sudden cardiac death, fatal coronary heart disease, fatal cardiovascular disease, and all-cause mortality. And there is so much data here. I mean, in terms of congestive heart failure, sauna use showed a benefit in reduction in PVCs, which are arrhythmias, improved endurance, heart size, and ejection fraction. That's really key when you're talking about congestive heart failure. And there's the source. What about ischemic heart disease? This is coronary artery disease. This is what is so prevalent here in Western diets and cultures. What do they see with sauna use? Improved vascular endothelial function. And folks, you don't even have to exercise. You just need to do the sauna. So hot, cold, hot, cold. Peripheral artery disease, improvements in pain, endurance, and blood flow. If you've got claudication, we call it, or pain in your calves, because maybe in the past you've smoked or you've had ischemic heart disease, things of that nature, sauna bathing may actually be beneficial. So sauna use or contrast showers, etc. What about elevated lipids? Total reduction in total cholesterol by 5 points. That's actually impressive there. And reduced LDL by 2 to 3 points. Not in like a year. In just 2 weeks, there was a reduction. And of course, inflammation, reduction in CRP, increase in IL-10, which we said before was beneficial at reducing inflammation. So definitely some benefits here to your cardiovascular system with sauna use. But unlike medications that we give sometimes that are good for one particular thing but have side effects in another category, sauna bathing actually is beneficial all around here. So as you can see here, in terms of Alzheimer's disease, there was an increase in brain-derived neurotrophic factor. This is one of the things that it actually improves the cleanup of the proteins that are not necessary in your brain, these proteins have been shown to lead to Alzheimer's disease. And there was an actual relative risk reduction 4 times per week versus just 1 time per week. There was a reduction down to 0.35. That's a 65% reduction. That's amazing. And that's the source for that. What about depression? It improved the antidepressant effect. What about growth hormone? This is what's so beneficial for people young who are growing, but also for people who are older and want to feel like they're young. Growth hormone has been researched extensively for this type of effect. And there was improvements in pain, endurance, and blood flow. And then far infrared saunas reduces fasting glucose levels in people who are diabetic. So again, documented. These are major journals, and it showed that there was a benefit. What about those who are really interested in physical fitness? So those of you who are doing exercise because you're in competitive sports, this is a real boon here. I mean, endurance, 30 minutes, 2 times a week, increased endurance in just physical exercise. So those of you who are on the cross-country team, they want to get better for their 5K run in terms of getting better times. Highly recommend looking into sauna use. How about preventing muscle loss? So as you get older, one of the problems is that you actually lose muscle mass. And daily heat treatments, even locally, prevented muscle atrophy. Okay, so what about toxins? So there are certain heavy metals that you may be exposed to, especially if you're living in inner cities where the pipes may be old, there may be lead, things of that nature. Well, guess what? Those heavy metals the body needs to get rid of. It's actually 17 times easier for your body to get rid of a lot of those heavy metals in sweat than it is in the urine. So sweating out these toxins may actually be beneficial in terms of the way your body gets rid of things. And what better way to sweat, of course, than in a sauna? If you are drinking lots of fluid, that's going to be very important. So some of the things that can be excreted in sweat is BPA. Remember, for a long time, BPA was used, and they finally got rid of BPA, and guess what they went to? Well, BPB, and there's BPC, and there's all these forever chemicals in these compounds that are being used in plastics and non-stick things, polychlorinated phenols, phthalate compounds used in shampoos. All of these things accumulate. They can actually be excreted in sweat. So getting rid of these things may be beneficial in terms of detoxification. So highly recommend that you look into heat therapy. And we'll talk more about how to do that. You know, not everybody can afford to buy a sauna or to buy a spa. Those are not cheap, right? So there are ways that you can do this for really inexpensive and still get the benefit. And we'll talk more about that. But, you know, speaking of sauna, that's not for everybody, right? So you need to make sure that you're drinking lots of water, because you can lose a lot of water when you sweat in these saunas. And if you're pregnant, there's could be health risks associated with the fetus if you heat up the temperature too much. So be aware of that. But I will just tell you that in Finland, there's a lot of women who are pregnant that do it anyway. I just be careful and maybe delay that until you have delivery of your baby. Children 2+, it's okay, but remember that their body volume to surface ratio is such that they can lose and gain lots of heat real quickly. So you've got to be careful with small children in these saunas. Okay, let's talk about hydrotherapy now. So we're moving away from saunas, and we're talking about the use of moist heat on the body. This is something that the world has been doing for many centuries, probably even millennia, even outside of saunas. So let's talk about the science about this and what's going on. And specifically in the acute setting. So in the acute setting, we're talking about is when you actually have an infection. And you have to understand the cells of the immune system. So we've got a nice little graph here about what it is that's going on. So the first thing you need to understand is that there are 2 arms of the immune system. There is the innate immune system, which is able to recognize invaders not based on specific proteins, but just in general and molecular patterns. And then there's the adaptive immune system. This is part of the immune system that makes T cells, B cells, antibodies based on what your body has seen before. So this adaptive immune system needs to be educated And the innate immune system does not need any education whatsoever. It can tell right off the bat if something is foreign or if something is self. And so, for instance, if you were to get an infection or a vaccine, the adaptive immune system would make antibodies and rev those up against that specific invader. But if that invader mutated in some way, the adaptive immune system might be a little bit back on its heels, whereas the innate immune system would be just fine. Now, as it turns out with some of these viruses that we've seen, for instance, let's talk about COVID or SARS-CoV-2. There are actual proteins in SARS-CoV-2 that shut down the innate immune system so that it can escape and actually multiply. And that's when the adaptive immune system tries to capture it and gets it away. The key that you should understand here is that the innate immune system gets weaker with age. So you might notice that in children, they don't really get serious as often COVID-19 infections, but they do make a lot of good fever. They make a lot of good heat, and that heats up the body. And this is what we've been talking about in this session. So understand that the innate immune system is the first barrier. It doesn't depend on specific proteins. It can recognize what is foreign, and it gets weaker with age. No matter how good your immune system is, it gets weaker with age. So anything that you can do to improve your innate immune system is going to be very, very beneficial. Okay? So one of the major products of the innate immune system is something called interferon. And it's well named because this substance, this protein that is produced by lymphocytes, actually interferes with viral infections. Let's read here what Nancy Go wrote way back at the beginning of the SARS-CoV-2 pandemic. She wrote, studies of SARS and MERS suggest that the interferon response is delayed. Compared with coronaviruses that cause mild disease, with milder cases of those two coronaviruses that can cause severe disease, the patients with severe SARS or MERS had higher viral loads and delayed interferon responses. Thus, it could be that the patients most susceptible to severe disease are those that cannot mount an effective early antiviral immune response. A study of 50 patients with cases ranging from mild to severe found that gene expression profiles indicating type 1 and type 2 interferon responses were highest in patients with mild to moderate disease and were low in patients with severe or critical disease. A similar difference in type 1 interferon activity was detected in the serum from the patients. Patients with more severe disease had less type 1 interferon activity in their blood. So you should understand then that interferon is very important from the very beginning when the patient gets infected if you want to have a mild infection. And actually, here's the graphic data that goes along with this. You can see here on the y-axis we have interferon alpha 2 concentration and interferon activity on this one. And you can see here very clearly that people that have mild disease had higher concentrations of interferon. People with mild disease had higher interferon activity compared to those that had more severe or critical disease. Here was another study. This one was published in the prestigious journal Science that showed that people that had mutations in their interferon factors here, so very low interferon, all of these had severe disease. Those that had antibodies against interferon, just because they had an autoimmune condition where unfortunately their body's antibodies neutralized their own interferon, all of these had very severe disease and their antibodies were low. Those that had no antibodies, notice they had very good responses, and most of these had no severe disease. In fact, what they said here in the Karolinska Institute, they said together these two papers explain nearly 14% of all severe COVID-19 cases. That's pretty amazing, actually, and I agree with that statement. So let's get down to the biochemistry of what's actually going on. For that, we go back to a study that was done 20 years ago, where they actually looked at heat and the influence of hypothermia on monocytes, which, as we said, are part of the innate immune system and can recognize the elimination of these pathogens, regardless of whether they mutate or not. Okay, so this is really important. This is a way of of getting around that adaptive immune system and boosting the innate immune system. So in this case, 12 healthy volunteers were immersed in a bath at 39.5 degrees Celsius. And they measured all of these different factors that we're talking about, and they exposed them to a endotoxin receptor and the complement receptors after the hot water bath. And what they found was this: 3 hours after this hypothermia, the response of monocytes to the endotoxin was enhanced because of the fact that they were at a higher temperature. And so they concluded that the thermal effect of fever directly activates monocytes, which increases their ability to respond to, in this case, bacterial challenge. But let me also say that these very same monocytes are also the ones that respond in viral and parasitic infections, all sorts of infections. And so a body, when it produces a fever, is actually part of the immune system. It's part of the response that your system is doing against the invader. And so it's really important that you don't try to suppress that fever unless it's, of course, really, really high and causing seizures or very high heart rates. So we talked about the heat part. What about the cold part afterwards? Well, this was a study that was published in the journal Physiology and was conducted at the University of Toronto by a grant from the U.S. military. And what they did was they exposed these guys to cold after heat. And notice what happened here. When we're looking at natural killer cells, there was an increase in the amount of natural killer cells and also an increase in the amount of lytic units here at 35 degrees Celsius. And then finally at 38, you can see that there was an increase. Then exercise, and then exercise at 35 degrees Celsius. So these are the different types of categories. And here they did duration of cold exposure at 0, 60, and 120 minutes. So there was an actual increase here in all of these categories. And they say here that this study suggests that despite popular beliefs that cold exposure can precipitate a viral infection, the innate component of the immune system is not adversely affected by a brief period of cold exposure. Indeed, the opposite seems to be the case. The fall in core body temperature resulting from cold exposure led to a consistent and statistically significant mobilization of circulating cells, an increase in natural killer cell activity, and elevations in circulating IL-6 concentrations. And to meet the statistical significance, notice, folks, they only needed 7 people in the study to reach statistical significance. That means that this is a very powerful effect. Let's go back to heat and COVID-19 specifically here. Here's a paper that was published looking at the amount of interferon gamma that was secreted from people after different core body temperatures. And notice what they found in the study, that if you increase core body temperature at 37 to 37.5 to 38 to 38.5, finally, boom, right there at 39, that the amount of interferon gamma that was secreted from lymphocytes after stimulation was almost 10-fold higher. That was an incredible amount of interferon that you're getting. This happens to be the very same molecule that is beneficial at preventing viral infections like COVID-19. And so it could be said that, at least if we connect the dots here, it would be interesting to see what a randomized controlled trial of hydrotherapy would do in patients who are just coming on with SARS-CoV-2 infections, or indeed any kind of viral infection where they start to feel like they're having body aches and things of that nature. So it's an interesting thing because not only are we thinking about this now, but people have thought about this in the past as well. And here's a paper I want to just sort of show you to prove the point. This was published over 100 years ago. And over 100 years ago, we had something here in the United States and actually around the world called the Spanish flu pandemic, or the influenza pandemic. Calling it the Spanish flu is kind of a misnomer. I don't believe it actually came from Spain, but it was called that for many years, and so that's what people know it as. But this is Dr. Wells Rubel. Now, Dr. Wells Rubel was a physician. He was also the medical director of a sanitarium in the northeast of the United States, specifically the New England Sanitarium. And these sanitariums were founded on the principles that natural remedies could actually be beneficial in treating people. So people would go to these sanitariums to get rest, to feel better, to get sunshine, fresh air, and they were escaping the growing hustle and bustle of the cities of the day. And so Dr. Wells-Rubel was well versed in the ideas of hydrothermal therapy or hydrotherapy that were pioneered by Dr. Jackson in upstate New York and also by Dr. John Harvey Kellogg, who was the medical director at the world's largest hospital at the time, the Battle Creek Sanitarium. And so when this Spanish flu pandemic came around, this is what Dr. Wells-Rubel wrote in a journal periodical called Life and Health on May 1st in 1919, titled As We See It. He said, "The present epidemic of influenza has furnished an excellent opportunity to test out the efficacy of rational treatment in dealing with respiratory disorders, especially in conditions accompanying and following attacks of influenza." So what did he mean by rational treatment? He was talking about rest. He was talking about exercise. He was talking about good nutrition. He was talking about sunlight exposure and also, very specifically, hydrotherapy. So let's see what he proposed to do in his article. So at the time, there were army hospitals who had the latest and the best in terms of technology. They had the ability, something that had just come out at this time was aspirin. Aspirin was invented in 1899 by the German company Bayer, and it was actually extracted from bark. And it was a very powerful antipyretic, which means that it was able to stop fever. It was an anti-inflammatory. And at the time, when people got influenza, there was a lot of inflammation that was associated with the body's dealing with the influenza. And so the feeling is that if we could get rid of the symptoms of influenza, you might be able to make some improvement. So these people were getting very high fevers, muscle aches, body aches, and aspirin was doing a very good job of getting rid of it. And if it didn't work, well, maybe you had to give a higher and even higher dose. So that's what was being used in the army hospitals. And of course, they had the best physicians and the best resources to boot. So if you understand influenza, you should understand one thing, and that is that typically there is the feeling of the body aches that we all have gotten when we've gotten influenza in the past. But with the Spanish flu, it led in a number of cases to getting pneumonia. And of course, this was in 1919. This is well before antibiotics have been discovered, penicillin being discovered in 1928. And so you can see here is that generally speaking in the army hospitals, and we don't know exactly the number, but they did publish this, and Dr. Rubel was able to get the numbers here. About 20% of the camp were those that came down. About 16% of those people who came down with influenza developed pneumonia. And you can think about most, if not all of these, were getting aspirin, which of course kills the fever and of course gets rid of inflammation. And then of those getting pneumonia, 40% of those ended up dead, which gives you an infection fatality ratio of 6.4%, which is fairly high. I mean, if you consider the standards, of course, it could have been much higher than that. We don't really have great records from that time. We don't know exactly how many people got infected in the world. We do know a little bit about how many people died. But generally speaking, 16% got pneumonia, 40% died of those that got pneumonia. Now compare that to 10 of the sanitariums in the Northeast where Dr. Rubel pooled the data on those that were treated as inpatients. So these were people that they could observe the treatments that they were giving, the fomentations as they called it. They were going out into the sun. They were getting fresh air. They were eating appropriate diets that were not rich in inflammatory factors. And you can see here that in those that came down, there was about 446 in the sanitariums, being treated in the sanitariums that came down with influenza. And they did not use aspirin. They did not use these things, but rather hydrotherapy, which heightened fever, which heightened the inflammatory response, especially that of the innate immune system, and shut down the virus early on. And whereas 16% developed pneumonia in the army camps, only 2% of those in the sanitariums went on to develop pneumonia. And and that was only 11. Now you can imagine that without X-rays, without antibiotics, and these were your run-of-the-mill physicians here in the sanitariums, not necessarily the bright youth of the Army hospitals. Instead of 40% dying of pneumonia, there was about 55% of those that died of pneumonia. Of course, there was small numbers to begin with. About 6 died, leaving us with an infection fatality ratio of only 1.1%. And you can see here that they made the argument that the treatment modalities that they were using in the sanitariums were better, superior, and rational compared to what was being done in the Army hospitals. Of course, this was not a peer-reviewed published journal, but an observation from Dr. Wells Rubel, one of the medical directors of this New England sanitarium. By the way, he later became the president of an organization on the West Coast called the College of Medical Evangelists, which was established at Loma Linda, California, now the ancestor of Loma Linda University. So interesting note. So where did he get this information from? Well, this is not gotten out of a vacuum. This was actually being looked at. This wasn't something secret or special. A psychiatrist by the name of Julius Wagner Jauregg, who was living in Austria at the time, also noticed that people who developed fevers seemed to get better from their other problems that they had. And one of the things that he noticed in his insane asylums, Dr. Jauregg Wagner, was that he noticed that people who had neurosyphilis, and again, remember, this is before penicillin, people who had neurosyphilis and started developing psychiatric issues seemed to get better after they had a fever for some particular other reason. So what he decided to do was something very interesting at the time, and it was kind of raised some eyebrows, but he decided, since they had the treatment for malaria down pretty well with quinine, was he would take people with malaria, take their blood, and inject their blood into those people who had neurosyphilis. And of course, the expected problem there, of course, would be that they would develop malaria in addition to their neurosyphilis. The bonus being that they would develop these very high fevers. And what would the high fevers do, of course, is it would prime the innate immune system to do its job, find these invaders, the treponemes, the syphilis, eradicate them, and then when that was done, the patient would then be cured of their malaria with the known treatment, which was the quinine. And notice what it says here in this article that was published in 2013 about this fever therapy in the treatment of neurosyphilis. He said, in the following years of his discovery, artificial fever was induced by any one of the following methods: the introduction into the patient of a parasitic disease, the injection of a foreign protein, injections of chemical substances such as sulfur, electrical means such as the administration of diathermy or radiotherapy, or placing the patient in an electromagnetic field, and simple immersion of the individual in a hot bath or placing him in a heat cabinet. Dr. Wagner's therapy was highly admired and was used on neurosyphilis cases well into the 1950s. And as you may recall, penicillin was discovered in 1928. However, with the introduction of penicillin in syphilis treatment, fever therapy effectively ended. Now, why did it end? It's because giving a penicillin tablet is far easier and much less labor-intensive than doing heat therapy. As you'll see when we learn a little bit more about heat therapy, it can be labor-intensive, and that can be very, very expensive, especially as you cannot scale human capital, right? You need many, many people to do many, many fomentations, but if you are able to scale the production of medication to a large degree, you're able to actually do that much better. Unfortunately, the problem is that while we've just discovered that heat therapy has many other side benefits, as we know today, medications have side effects like penicillin allergy and wiping out good bacteria as opposed to just the bacteria that you want to wipe out. So there are good things. Obviously, I will use antibiotics in my ICU when I have to, when my back is against the wall and a patient is about to die. I don't care about good bacteria when a patient is about to die. I care about killing the bad bacteria. And so different situations call for different remedies. But if this is what you're trying to do and you want to do it in a way that has the least amount of side effects, sometimes doing this can actually be beneficial as well. So realize that there was a time and a place in society when heat therapy was actually well recognized and used, not by people who were considered alternative, but by the main thinkers of our society. So here's the question in the last slide, and sort of what I want to talk about is, what should you do? What can you learn from this presentation that you can apply in your life where the rubber hits the road? Take advantage every day. Most people take showers every day, or at least every other day. Take an advantage here and shower hot for about 5 minutes, and then at the very end, cold for 1 minute. And you can repeat it a couple of times if necessary. But I've talked to people who have done this, and I do this myself. And I don't drink coffee, but for those who do drink coffee, the amount of energy they say they derive from doing this practice is like that of a cup of coffee in the morning, especially if you're doing it in the morning. Some people do it at night, and it's interesting. I find that if it's done in the morning, along with your circadian rhythm, it tends to give you energy. And if you do it at night, it tends to calm you down a little bit. So I think it's actually quite beneficial. So that's the first thing that you can do. If you have access to a hot tub, heat it up to about 104 degrees Fahrenheit, which is about the maximum that you can actually do in the United States, because they kind of set that as a goal. You can't really go much higher than that. Do it for about 20 minutes and then follow it up with a cold plunge. Okay? So these are sorts of things as we call tonics or prophylaxis. This is stuff that you should do on a daily basis to keep your body in flux, so that there is a buildup of those heat shock proteins as a preventative. Now, if you were to come down with a viral infection, then you may need to do something more than that. But I would even say, even for these things like contrast showers or hot tubs, make sure that your physician is okay with doing this. There are a couple of conditions where you may not want to do this. For instance, if you have a heart condition that causes your heart to go fast, you don't want to be passing out in the shower or in a hot tub. Those are kind of dangerous places. So just make sure that they okay it for you, and follow up. Okay, so what about if you actually get sick? So for that, you want to get a little bit more extreme, and that is something we call a fomentation. I just refer you to a couple of reference websites, if you will. One of them is called hydrotherapyathome.com. That's all one word. And the other one is hydro4covid.com. And those have excellent resources that take you through step by step about how to do a fomentation. I'll just kind of briefly describe it for you here. Basically, what you're going to do is you want to place these hot towels on your body to heat it up for about 20 minutes and then remove them and submit yourself to something cold for about a minute. And the way we do that is getting your, so laying down on either the carpet or something that the carpet is protected, because there's going to be some water. And you've got your feet in a bath of basically as hot as water as you can tolerate without burning your skin. Now, I'll just say that for those of you who are diabetic and can't feel your feet, you're going to probably want to skip this because you don't want to burn your feet. That's going to cause some problems. So make sure that you don't do that. You can heat up these towels in various different ways. You can boil water on a stove and put the towels in there. You can put towels that are soaked in a microwave. Sometimes they even have devices that are like heating blankets that are, heat up more than a heating blanket. And you can use that to keep things hot. But basically what you're going to do is you're going to put a hot towel on the bottom. You're going to lay on this with a layer of towel in between so you don't get directly burned by that towel. So it's kind of like a 2-towel layer so that the towel that's touching your skin is dry and not heated. And then the heat is going to penetrate through that towel by another towel on the other side that's heated and wet. And you're going to do this both on your back and on your front. And you're going to put your feet, if you can, in a hot bath. And then you're going to cover up. And so essentially what's going to happen is that heat is going to get transferred to your body. You're not going to be able to cool yourself down. And so your body is going to sweat profusely. And so you want to make sure that you're drinking lots of water before you do this. And you do this for about 20 minutes. And usually someone is helping because the towels will not remain hot long enough. So you got to continuously be heating up towels and putting them on there so that you do this. So the point is that you're heating up, you're making an artificial fever for yourself. Now, when you get done with the 20 minutes, you pull all of this off, you put your feet in ice cold water, and you get an ice cold towel and that's wet, and you basically apply it to the chest, and you kind of rub up and down to kind of, it's called mitten friction. And the reason why this happens, well, there's a lot of reasons, and a lot of cultures that have done this for hundreds of years. The Finns, when they come out of a sauna, will take a stick and kind of hit themselves with a stick. And other people do it, or they might take leaves, or they might, just sort of rub themselves. And the purpose here is to get the white blood cells that are stuck to the walls of your blood vessels off and into circulation to do what it is that they need to do. So there's always something called demargination, which is where these white blood cells, which are stuck off to the side, come into circulation and do what they need to do when you take a cold shower. So if you were to take a cold shower and measure the number of white blood cells in circulation, those would definitely go up. And that's what you're aiming to do, is to get those white cells into circulation and traveling around your body, looking for the infection, going to the infection, and actually taking care of it. So that's kind of a fomentation, and it's an alternative, and it's actually probably, out of all the things on here, it's probably one of the most effective things to do, and it's actually pretty cheap. Everyone has access to hot water. Everyone has access to towels. You don't have to be with money to buy saunas. What you're buying there is convenience. All of these things can be done if you put the time in and do what you're supposed to do. I would definitely say one of the biggest risks in doing hot fomentations is burning yourself, either burn the person doing the fomentations or the person helping you with it. Both of you can get burned, so you have to be very careful and be cognizant of the fact that, especially if people have difficulties with skin sensation. So if diabetics can't feel their feet, you got to be careful that you're not going to burn. Okay, so what about sauna? So saunas, we talked about at the very beginning. Here's my recommendation based on the data. You really ought to be getting the sauna up to 174 degrees Fahrenheit for at least 20 minutes and doing it about 3 times a week, and then ending with cold. And then the major benefits that we talked about from that were reviewed, and we've talked about that. Okay, so we've talked about hydrotherapy, we've talked about fomentations, we've talked about sauna, we've talked about the use of artificial fever in patients and in subjects, not only to treat specific infections and specific acute indications, but also overall for cardiovascular health, for neurological, for mood, and for overall mortality. So there's a lot of benefits to this. And it should be used in conjunction. I would recommend highly that you talk to your physician to make sure that there's not something that you haven't thought about that may be a harmful thing based on your conditions. And here's the key: drink lots of water, making sure you're well hydrated, because you can lose lots of water when you're doing this type of activity, and make sure you don't burn yourself. So very interesting data, and I think things that we can apply in our lives right now, in real life, in real time, to make a real difference. So I want to thank you for joining us for Real Health on Tuesdays. And this is Dr. Roger Seheult signing off. Thanks for joining us.